Welcome back. You're still watching Good Morning Namibia on NBC. Now, the festive season is a time of celebration, but it also brings an increase in common emergencies such as choking, burns, alcohol-related incidents, and cardiac events. Knowing basic first aid steps, especially CPR, can make a life-saving difference, of course, while waiting for paramedics. Joining me now on the set, of course, on the main set here in Studio 2 is to give us a focus on simple practical actions anyone can take during holiday emergencies is Paulus Mungungu, who is an advanced life support paramedic, and Youmallen Griffiths, who is an intermediate life support. Gentlemen, good morning to you. Welcome to Good Morning Namibia.
Good morning. Good morning.
Absolutely. Gentlemen, before we actually get into this discussion and also get a bit of a demonstration of CPR, perhaps just help us understand both your titles. Let's start with you. What exactly does an intermediate life support paramedic does?
So what we usually do is we treat patients on an intermediate level of care, where this usually has a slight amount of drugs compared to advanced life support, and we can do a bit more into depth medical procedures and techniques compared to the lower levels like basic life support and first aiders and so on, whereas a paramedic and advanced life support and ECTs can do much more.
Okay, tell us exactly what more you actually do, Paulus, as an advanced life support paramedic. Yeah.
Okay, good morning.
Yeah.
As you said, my name is Paulus. I'm an advanced life support paramedic. The title advanced life support paramedic it's an addition to your scope of practice that allows you to do more advanced procedures, such as when it comes to airway management. We do more invasive procedures that some of these procedures that are even done in casualties in hospitals, we can do them on the side of the road or in somebody's house. So our training is just more prolonged and the scope is more broad.
Okay.
Yes.
That also entails that you also sometimes have some of the equipment that are used in the hospitals, and that's what you deal with.
Yes, we have equipment such as mechanical ventilators, defibrillators, right. A whole lot of equipment that are similar to those in the casualty department, and a broad scope of medications as well.
Yeah, very well. Yes. All right, Youmallen, let's start by understanding, first of all, what are the first steps a bystander can do? If you find yourself in a situation where, of course, somebody then gets into an incident where they aren't able to breathe or something happens where the CPR is required, what are some of the first steps that you actually advise they take before the paramedics arrive on the scene?
Okay, so the most important thing that we need to look at is your safety as a bystander or someone who's willing to assist the next person.
Right.
And therefore also indicate or notice that whether the patient is in a safe environment for you to conduct any initial treatment. And from there, we need to check whether this patient is conscious, unconscious. And by determining that, we need to literally tap on the patient, try and shout with the patient to see whether there's any response. Should there be no response, we shout for help, call for advanced life support to come. And then should the patient be not breathing, and then we immediately initiate CPR.
What is your advice to someone who's, of course, like a bystander, for instance? How will you be able to tell if this is, a mild choking or just a serious airway blockage?
Okay, so when it comes to choking, patients who are mildly choking, they are still conscious, they are still alert. They'll either try to cough the object out, or they'll try to, they'll basically try to cough. They'll be conscious, they'll be talking to you, I think I'm choking. That is a more mild form of choking, whereas when it comes to a more severe type of choking, usually they're not able to speak, they're not able to cough, and they usually hold their neck in this position. This is the universal choking sign. Okay. So if somebody is not speaking to you and they are constantly just like this, looking at you, trying to get your attention, it means they could be choking. And in more severe cases, where they've been where they have not been breathing for a prolonged period of time, they can become unconscious. That's when it becomes more severe and very dangerous. That is when it's vital to recognize and try to do something about it.
Okay, let's talk about that something to do when you, of course, then see someone having a serious airway blockage.
Yes.
You see them in that position, the universal choking position that you just demonstrated. What's the first thing I can do to try and help them, if by any chance?
Okay, so if the choking is moderate, like if they're still coughing, you should encourage them, please cough, to try and expel the object. You can give them back blows to try and assist. But if that is not helping and it becomes too severe, it is recommended that you try and lean them forward a bit, if possible in a sitting position, and you give them back blows, like really hard, depending on the age. If it's a small child, you don't use as much force as an adult, so you give them back blows like really hard, okay? And then if the object does not come out, you give them what we call abdominal thrusts. Okay, I think Youmallen can demonstrate on me later.
Absolutely.
Yeah.
Okay, before we get back to what, of course, is going to be the demonstration of an airway blockage, let's talk about other matters, Youmallen. Let's talk about how to treat minor burns at home and when it actually should be considered as an emergency.
Okay, so with minor burns, when it comes to burns, our most concern is the possibility of high infections. Okay, so first thing not to do is we do not apply any home remedies like applying lotion and all that, or applying ice onto the wound, because this will only cause a risk for infections. Yes, so the first thing we need to do is run the wound area under cool running water for plus minus 20 minutes. And cover it up with a loose Band-Aid, non-sticky Band-Aid.
Okay.
And then if should the patient have any rings or jewelry on, just loosen them, as wounds are prone to swelling. So we need to remove them just to allow circulation to the other extremities. And when it comes to emergency, when blister starts forming or when the burn area is usually larger than the palm of your hand, then, and also considering the area of burn like face, arm, hands and feet and genital areas. So that's our areas of concern, then we need to take immediate action and take a patient.
That's when it's a serious emergency.
Yes.
All right. Let's talk about drowning, Paulus. In an event where we have someone, I'm a bystander and someone is drowning, how does the response differ depending on whether the person actually is conscious or unconscious?
When it comes to a drowning patient, it's there's so many different views you can look at the scenario. Okay, so first of all, you have to recognize if somebody is drowning. Let me say you are by the pool. It's not really easy to recognize if somebody is drowning. So you should be very you should look at subtle signs such as the head popping up and going back underwater, somebody raising their hands maybe or screaming. And then once you recognize that, it's very important to try and get help for the patient, for the person to be removed from the water. But it's not safe to do so by any person that is not trained to rescue people that are in drowning situations, because that is a drowning patient is a hazard on its own, because they can cause, if you attempt to save them, they panic, and with them panicking, they can cause you to become a victim of drowning as well. So if available, please alert a lifeguard, call for emergency services, and then if there's a floating device that you can throw to the patient, that can work. You throw them a floating device from a safe distance, and you maybe pull them out of the water. Once the patient is out of the water, and then they are conscious. Okay. Once they are conscious, it's good. You try to speak to them. Hi Youmallen, how are you doing? Encourage Youmallen to cough, because Youmallen, that's another type of choking, basically. Youmallen, cough. Are you okay, Youmallen? How are you doing? Still call the ambulance. Explain to the ambulance what happened, and try to get him to the hospital as soon as possible. If Youmallen is unresponsive after a drowning incident, it's very important that you recognize that he's unresponsive. So you go to Youmallen. Hi Youmallen. Youmallen is not waking up. You look at Youmallen. Does Youmallen look like he's breathing? Is his chest moving? If his chest is not moving, Youmallen is not speaking to you, immediately call for the emergency services and begin CPR. is you locate just by the center of his chest, you push hard and you push fast. That is very important because from the moment Youmallen stops breathing, you have plus minus 4 minutes before Youmallen's brain begins to die. Okay, so if you do not initiate the chest compressions immediately, we risk Youmallen's brain dying, and by the time the emergency services come there, Youmallen's brain is probably already beginning to die, and the chances of him recovering, even if he does come back, is very poor. Okay?
Very wrong.
Yeah.
All right, thank you so much. But God forbid that your brain fails, of course. But please just give us a demonstration then of how this situation actually unfolds when you're trying to perform a CPR in an emergency. Please just give us a demonstration.
Okay, as I mentioned earlier, the first thing we need to do is make sure the scene is safe for you and the patient.
Right.
And then coming to the patient, we need to tap on either patient's shoulders, both shoulders, see any response from eyes or body movements. Okay, should there not be any, we shout for help. Paulus, please call for advanced life support, resuming CPR. So when indications for CPR is usually by checking if the patient is breathing. And how we do that is going down to the patient, listening for any breathing sounds that might come from the patient or any warm air coming from the patient.
Right.
And with the same time, with the eyes on your chest, checking whether there is any chest movements.
Okay.
Okay, if all those are absent, we initially start to do CPR by locating the correct area to do CPR with the palm of your hand in the middle of the chest.
All right.
Interlocking with your other arm. So with CPR we have a sequence where a ratio where we do 30 compressions, followed by 2 rescue breaths. But should you not have the correct device to perform rescue breaths, we just continuously continue with chest compressions.
All right.
Okay, so it's always also just better to count out loud in case you are able to do rescue breaths.
Okay.
Okay, so we do press down the chest 5 centimeters deep or as hard as you can and allow the chest to come up fully. This allows for circulation to start taking place throughout the patient's body. So it's going to go like 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 28, 29, 30. When you reach 30, this is the area or the time where you need to provide rescue breaths if you are able to. When you're having a proper administering device, then you open the airway properly, you give blows, and then you resume doing CPR.
All right. I think Paulus was showing us something. Please just go ahead by showing that. Yeah.
So there are so many misconceptions that we see from the TV. See somebody doing CPR and they start giving mouth to mouth. That is not really ideal. It is not recommended.
Right.
We have this little device here called a mouthpiece. It usually comes with first aid kits. If you do have a first aid kit at home,
you can just raise it and then show it to the camera at least for a few seconds. This camera right here. Very good.
Yeah. Okay. This is how it looks like. So basically, this part goes into the patient's mouth, and then this is a barrier between the patient's face and your face.
Okay.
And then you can give your breath through here.
Okay.
Okay.
All right.
So basically, this is how it should look like. So you do not have any contact between the patient's face and you to, just for your own safety.
Yeah, that's absolutely, yeah. All right. All right, that's the CPR. I think you still want to continue showing us a couple of demonstrations on how to so what happens then, in fact, after you have then gotten a sign that this person is breathing or not?
Okay, so with CPR, is usually when the patient has gone into a cardiac arrest. So this means the patient's heart has stopped pumping. Yeah. Okay, so when we stop doing CPR is when the patient has any signs of life, like starting to cough or there is responsiveness from the patient. Okay, should you not get any of that, you do CPR or you continue doing CPR until help arrives. And that's the only time you stop doing CPR, or when you are too exhausted to continue any further. Yeah. That's the only time you stop doing CPR. And then you just continue until help arrives. So should the patient recover from CPR, we would like to put the patient in a recovery position. Okay, so by putting a patient in a recovery position, we would like to slide them onto their side with one hand under the head to support the head from any injuries. And the upper leg slightly pushed forward in order for the patient to be in a comfortable position, and then you just continuously monitor the patient until advanced help comes, and then you hand over the patient to the ambulance guys that came.
Very well. All right, let's go back to the choking situation. Of course, when you're trying to assist someone who, of course, is in a situation where they are choking. Please just give us a demonstration of that, yeah.
Okay. Mullen, would you like to do it on me or the man again?
Okay, so when you notice a patient is choking,
Just move a bit, yeah, in the center, yeah.
So when you notice a patient is choking, firstly, we need to make sure that this patient is really choking. So we need to ask, sir, do you need help? Okay, if the patient is continuously coughing, and you inform them that, okay, I'm going to assist you now, and you slightly lean them forward, okay, with 5 hard back slaps to try and dislodge whatever object is blocking the airway.
Right.
Okay, and should the patient not recover, or should the scenario get worse, we will be getting signs like the universal sign of choking that he's having currently. We also look at the patient's extremities of fingertips, mouth will be turning bluish. That's an indication that there is a lack of oxygen throughout the body. Then we stand behind the patient, forming a fist with the one hand, in between where the ribs come together, just under the chest. We fold a fist with the other hand, cover it up, slightly leaning the patient forward with hard upward thrusts.
Okay.
5 times to try and dislodge the object from the airway.
Very well. Now let's think about a situation where it's a holiday season, of course, that that's upon us, and we are at an event. A situation happens where somebody actually gets into an incident. What is the most important information to actually give someone, or rather the emergency services upon arrival? Perhaps Mbango, you can take it up, or you can share it.
We can share. We can add on what I missed maybe. Okay. So it's very important to mention the location where you are. Okay. We're at Youmallen Stadium, and then what happened? What is wrong? Okay, somebody collapsed. Do you perhaps know the patient's age? Relay the age to the call center. If there are any relatives that know, maybe if the patient has any chronic illnesses like asthma, diabetes, that will be helpful if you can tell us no. Patient collapsed. We're at Youmallen Stadium. She's 24 years old and she's known with asthma. She left her pump at home. That gives us more than enough information to prepare for what we are coming to treat and to just speed up the treatment process.
Absolutely. Yes. Perhaps would you like to add, Mr. Youmallen?
Yeah, just a slight brief explanation on why those information is very important to be given, is so that should we respond to your location where you are, we know exactly where you are, we can move directly to there rather than searching a bigger area on where you really are. And also the medical history thereof is so that we already come with a plan on how to initiate treatment, and also already make the necessary precautions on what treatment method are we going to use, what level of qualification does this patient really need, and also, like again, depending on the seriousness of the patient at that time.
Absolutely.
Just to add on what he said as well, so it's also important to know landmarks or famous places around where you are. Let me say you are in a specific street, but it's not so well known. So we might not know the exact street, but if you say it's next to Spa in Commercial, or we know where Spa is, so it's easier for us to get there.
Very important notes, Sergio. Yes. Gentlemen, thank you so much for the demonstration, for the information that you've given us, and also I think it's also a high time that we also appreciate you for the great work that you're doing, of course, continuing to save lives, and of course carrying out that very difficult exercise. So thank you so much. Wish you, of course, all the best in your work, and I hope to speak in the future about how we can keep, of course, all Namibians safe. Yeah.
Thank you very much.
Thank you very much for having us as well.
Absolutely.